फीवर एफएम सुन रहे हैं आप। मेरा नाम है इलाही, शो का नाम है वेक अप दिल्ली और आज कुछ ऐसी चीज के बारे में बात करेंगे जो मेडिकल साइंस से रिलेटेड है। You must have come across people, especially women, with brown color patches right on their faces. These freckle-like spots form large flat patches. This is nothing but just melasma. Today, we are taking a moment to raise awareness about this common skin disorder, and this is a very misunderstood skin condition. It is a pigmentation disorder that causes brown and gray patches to appear on the skin. एंड प्राइमरीली इट हैपेंस ऑन द फेस। अनफॉर्चुनेटली काफी सारे लोग इसको मिस्टेकन ले लेते हैं स्किन डार्कनिंग से, और इसके बाद जो क्वेस्ट है फॉर फेयरनेस ये रिजॉर्ट होता है ओवर द काउंटर स्टेरॉइड क्रीम से। एंड पीपल डोंट रियलाइज द फैक्ट दैट दीज कैन लीड टू वेरी सीरियस साइड इफेक्ट्स एंड इवन वर्सन द कंडीशन. And it not only affects the skin, but it also can have a significant impact on self-esteem and emotional well-being. And to shed light on this topic, we have Dr. Priyanka Jaju with us, who is a leading dermatologist from Delhi. Dr. Priyanka, thank you so much, first of all, for sparing your valuable time. And, today we are going to bust some myths, and today we are going to learn about what is melasma. So there are a lot of myths that are there in the market, right? And as soon as people open up Google and people open Instagram, they consider themselves to be doctors. So right now we have a professional inside the studio who's going to tell us what are the main causes of melasma and who is most at risk of developing this condition.
Yeah, hi. First of all, thank you so much for having me and raising this important topic, which is very easily ignored, which is melasma. So, simplifying it down, melasma is basically caused when you have your melanocytes which become overactive.
Okay.
So this happens when there is a lot of sun exposure, primarily the UV rays, which stimulate your melanin and cause pigmentation. Secondly, when there is hormonal changes in your body, like when there's pregnancy or when you're on birth control pills or menopause or any kind of medications can trigger melasma. Genetics can sometimes trigger melasma. Stress, thyroid has been directly linked to melasma. So, all in all, it most commonly affects females between 20 to 40 years of age.
Okay.
And people with a family history, like I've said, and those who reside in a sunny climate or those who live in the mountains because they're closer to the sun. So, more exposure to the UV rays. So, they're more prone to melasma.
Okay. Dr. Priyanka, how can someone recognize the symptoms of melasma and what steps should they take if they suspect they have it?
Okay, so melasma, it presents as flat, brown, symmetrical patches, most commonly seen on your cheeks, upper eyebrow, upper lip, forehead, chin, and bridge of the nose sometimes.
Okay.
If you suspect that you have melasma, first and foremost, consult your dermatologist who is going to diagnose it and guide you properly. Secondly, very strict sun protection, because sun, as I told, UV rays have a direct connection with melasma.
Yeah.
So, very strict sun protection. And if you know some kind of trigger which is causing this melasma, like any hormonal imbalance or any medications, or if you're using any skin irritants, so you first foremost recognize that and then stop it. And just consult a dermatologist, they'll guide you properly.
Dr. Priyanka, we live in a world where everything is on a 7-inch and a 14-inch screen. And because of that, people are very self-aware of the fact how they look, how they physically appear. And with such skin disorder, it can significantly affect somebody's, you can say, a person's self-esteem. So, can you talk about the psychological impact this condition can have on an individual and how can they, battle it out?
Yeah, like imagine waking one day, looking up in the mirror, and you see brown patches on your skin, on your face, which was not there few days ago.
Correct.
So it's a very kind of not just a cosmetic concern, but a very emotional struggle for the patient as well.
Okay.
Medically, though it's harmless, but there is severe psychological distress. So it can affect your self-esteem, body image. There have been studies where it has been shown that 43.3% patients have lower self-esteem.
Okay.
They have distorted body images. Patients up to 43% can suffer from anxiety, severe depression, and there is social withdrawal because you're afraid of judgment and causing unwanted attention because of the patches on your face. So it's not just treating melasma is not just about your skin's appearance, but it is about restoring confidence and emotional well-being. If we ignore the psychological aspects for a prolonged time, it can cause distress. It will affect daily life and relationship as well.
So it has a lot to do with not just how you physically appear, but the psychological impacts that you might have or an individual might have. But are there any current treatment options that are available for this skin disorder, and any new advancements that have happened in the area?
A lot of treatment options. The current treatment options which we have are topical treatments, oral medications, and procedural.
Okay.
So topical, first and foremost, the gold standard treatment, which is hydroquinone, available in the market.
Okay.
But we strictly recommend it is done under medical supervision only. It should be applied only under medical supervision, and that too for a very short period of time, because it has a lot of side effects. Other than that, the other molecules available are tranexamic acid, azelaic acid, niacinamide, cysteamine, kojic acid, retinoids. But the percentage and the formulation and the molecule suitable for your kind of melasma, which will be decided by a professional dermatologist, of course. Apart from that, the procedural treatments available, we have chemical peels.
Okay.
Chemical peels utilize acid to stop the melanin from transferring or overgrowing of the melanin.
Okay.
Second thing we have is microneedling. Microneedling basically causes micro injuries, and this helps the topical treatment to penetrate better, as well as it improves collagen production. Third, we have light and laser therapies. Though it is very effective, but there are very high chances of rebound. So it is, the better is a combination treatment, and there's a lot of newer studies coming up for melasma treatment. We are studying about platelet-rich plasma in melasma. There are newer agents coming up. There's oral tranexamic acid, which is found to be very effective in melasma.
Okay.
Then going towards natural treatments, curcumin is supposedly working really well in melasma. So there's a lot of study going on, finding about the newer molecules.
Ma'am, we live in a world where, everyone has a smartphone, and before you consult a doctor, everyone just Googles out things, and, we have a habit of checking out symptoms online, and whatever Google recommends us, we think that this is the thing. We have a professional inside the studio, and we want you to actually tell us what are the preventive measures that people can take to reduce the risk of developing melasma, and it can be also about how they can manage the symptoms effectively.
Yeah. So, like I told, there are a lot of treatment options available, but prevention remains the key. The first and very important thing is prevention. Firstly, prioritize sun protection. Use a broad spectrum sunscreen, at least SPF 30 and above.
Okay.
And if you're outdoors for a longer time, keep reapplying after every 2 hours. Apart from sunscreen, physical barrier like your physical sun protection, hats, scarves, umbrellas, very important. Avoid aggressive treatment, regularly exfoliating your skin using harsh scrubs that damages your skin. Avoid that. Monitor your hormonal influences. If you feel there's any hormonal disbalance happening in your body, consult a health professional for that. And in medical language, the other name for melasma is mask of pregnancy. So very commonly seen during pregnancy. So just consult, and especially during pregnancy, sun protection is very important. Manage your stress levels, have a very healthy lifestyle, and consume antioxidant-rich foods like berries, leaf green vegetables, citrus fruits. And apart from that, engage in a good physical activity, keep exercising regularly. That should keep it under check.
Dr. Priyanka, there are many myths that are around melasma. Can you debunk some of the most common misconceptions about this condition?
Yeah, the most commonest misconception which every one of us hears or we know is only women get melasma, which is not true. So it is equally common in men. In fact, I feel it is more resistant and much more harsher in men than in women.
Oh, okay.
So, and like I told, the second thing is it occurs only during pregnancy, again, which is not true. It can occur whenever you have any kind of hormonal disbalance or you are on any medication. It can occur. Sunscreen is not necessary indoors, is what we used to hear earlier. If you're going out, just apply a sunscreen. No, it is not true. So UV rays can still penetrate windows, and there's a lot of blue light concept coming up from LED lights and desktops, and we are on the screen always. So sunscreen is as important indoors as outdoors. Then again, a lot of our relatives and anyone who sees it, they'll be like, melasma is not treatable, which is again not true. It is treatable, just the right amount and the right kind of treatment is important. And the other misconception is once treated, it will not come back, which is again not true. It is known to recur very commonly.
Okay.
And any kind of scrubbing, like patients feel like if they go for very harsh scrubs or something, aggressive scrubbing, maybe it will remove the pigment off, but no, it is going to damage your skin further.
Yeah.
And gentle skincare is actually recommended when you have melasma.
Dr. Priyanka, there used to be a time when I was growing up, there was all these ads that used to come up on television regarding fairness, right? And now that we have grown up, we have realized that, physical appearance is very important for a lot of people. And then there are people who use over-the-counter, fairness creams, which are full of steroids. And these fairness treatments can actually lead to very serious side effects. Can you explain the risk that are associated with such creams which has high amount of steroids in them, and why they should be avoided?
Yeah. So topical corticosteroids are really potent medications, which is actually used to treat inflammatory conditions like psoriasis and eczema. But over the long-term period, they actually cause hypopigmentation, which is skin lightening, which is a kind of side effect of topical corticosteroids.
Okay.
But the thing is that lightening is temporary. So once you stop your corticosteroids, it's going to come back, and it's going to come back even more harsher. Again, applying topical corticosteroids for a very long time, it can cause skin thinning. It can cause skin atrophy, which can lead to bruises, tears, and stretch marks. It can cause acneiform eruptions, that is red bumps which is seen on the face, which is called steroid-induced acne. It can cause hypertrichosis, which means there will be more hair growth on the area where you have applied steroid.
Okay.
There can be steroid withdrawal. Suddenly, if you stop using your steroid, it can cause burning, redness, peeling of skin, which is called as topical corticosteroid withdrawal. Applying corticosteroids for a very long period of time, it can actually cause your adrenal gland suppression, which can lead to fatigue, muscle weakness, and actually very rarely life-threatening conditions.
Okay.
So over-the-counter topical corticosteroid application is actually very dangerous, not as simple as it appears.
And lastly, what advice would you give to someone who has been diagnosed with melasma and who is struggling to manage it?
First and foremost, prioritize your sun protection. Sun exposure, as we know, is a primary trigger for melasma. Even on cloudy days, if you are indoor, UV light can still exacerbate your pigmentation.
Okay.
Use a very broad spectrum sunscreen, SPF 30 or above, and look for a tinted sunscreen which works very well because it contains iron oxide, which acts as an extra barrier of protection. So any sunscreen formulation containing zinc oxide, iron oxide, they work well for UVA, UVB, and visible light. And second thing is keep reapplying your sunscreen. Very important.
After every 2 hours, you have to apply sunscreen if you are out there in the open. Okay.
And opt for a very gentle skin routine. Use fragrance-free products. Select gentle cleansers. And exfoliating too frequently, it can irritate your skin, so avoid that. Explore treatment options. Talk to your dermatologist regarding any kind of issues you're facing. If you have any kind of stress, try and manage your stress. Practice stress relief techniques like yoga, meditation. It really helps. Any kind of hormonal imbalance you're having, talk to your personal professional. They can guide you. And a dermatologist can help identify your skin type, your potential triggers, and recommend appropriate treatments to manage your melasma effectively.
And not to believe anything that is being written out there on the web. That's more important.
Very,
go to an expert for any advice or any consultation. Thank you so much, Dr. Priyanka, for sharing your valuable insights with us today. It's crucial to actually, continuing to educate ourselves and tell people about the conditions like melasma, which are commonly mistaken by a lot of people, so that we can foster more supportive and informed community. So thank you so much for sparing your valuable time. And for the listeners out there, let's spread awareness about melasma. I mean, it's skin pigmentation issues, while discouraging the misuse of harmful steroid creams. Don't go out for just how you physically appear. Make sure that you are healthy from the inside as well, and make sure that you don't consider yourself to be the experts, because there are experts who are going to give you great advices, and you don't get into a false trap. So thank you so much for your valuable time. This is Melasma. Thank you so much.
Thank you.